A broken bone, meaning a fracture, is a serious incident. It is imperative to administer first aid in such a medical emergency correctly and quickly. In the previous video of this series, we saw how to provide first aid in case of a fracture. We learnt the importance of keeping the injured part immobile in case of a suspected fracture. We will learn about this in detail today. Our topic today: how to support the injured part in case of a suspected fracture. This child may have broken a bone, but the elder sister makes him walk immediately. This is a big mistake. If the bone is broken, then the injury may worsen. The severity of the fracture may also increase due to pressure or weight. In case of a suspected fracture, arrange to take the patient to the hospital immediately. Call for an ambulance and provide first aid like this. In this case, the most important step is to provide support to the injured part to immobilize it. Remember the basic rule of immobilization. Provide support to the joint above and below the injured part. It is not difficult to understand why. Stabilize the injured part in the position it is in. Do not try to bend it or straighten it. Let us first learn how to provide support to a leg with the help of a splint in case of a suspected fracture. A splint could be anything that is hard and strong enough to provide support to the injured part. In this case, this leg bone may be fractured, so the joint above is the knee and the one below is the ankle. Find anything hard and suitable for splinting. This flat, even and strong strip of wood can do the job. This is a little rough, so begin with wrapping the leg with a soft, clean cloth. Now, place the splints like this on both sides of the injured leg. It should be long enough to reach from above the knee right up to the ankle. Then tie it with a cloth or string as shown. The knots should be such that they provide adequate and firm support, but they should not be so tight that they interfere with the blood supply. In case there is a wound, then take care not to disturb it. If you are unable to find anything suitable for splinting at the accident site, then tie the injured leg to the healthy one like this. Remember the basic rule: you have to keep the joints above and below immobile. Ensure that the knots are not on the wound. Do remember to check the color and temperature of the injured limb after tying the knots. In case of any change, loosen the knots. After immobilizing and providing support to the injured part, you may elevate it. Place it on a bag or any object easily available. Make sure that elevation does not worsen the pain. Keep the patient calm and immobile while waiting for the ambulance. Keep an eye on the patient's condition. You may apply a cold pack to the affected area while waiting. Now, let us watch how to immobilize and support an arm in case of a suspected fracture. Here too, the aim of first aid is to provide support to the joints above and below the injury and keep it immobile. Provide support with a splint fashioned out of any suitable hard and strong object. Tie it to the arm with a cloth. After tying the splint in place like this, you may support it with a sling. Fold a large piece of cloth into a triangle. Slip the arm through this with the arm resting on the base of the triangle. Take the two upper ends of the cloth and knot them behind the neck as shown. Adjust the sling so that the injured arm rests against the chest. When correctly placed, the hand will be slightly above the elbow and the fingers will be jutting out from the sling. Check the patient's pulse and go to the doctor at the earliest. Always remember, first aid is provided only as initial and immediate assistance. It is important to seek medical help at the earliest. The basic rule of first aid in case of any fracture remains the same. Immobilize it and take the patient to the hospital at the earliest. In case of fractured ribs, backbone, or skull, arrange for an ambulance immediately and urgently. Time for your task. Find out how to apply a splint in case of a fracture to different parts of the body, like fingers, wrist, ankle, toes, and upper arm. Take a partner and practice how to apply a splint and sling. Take turns and practice on each other. Remember, the patient is in tremendous pain in case of a fracture. It is important to provide first aid efficiently and quickly in such a situation. Learn first aid. Stay alert. Stay well.